Right. Hi, everyone. Thanks for joining us. We're going to give it just a couple of minutes here for those folks that are running in between meetings, and then we'll get started. Everyone, we'll get started here and we'll give it another minute or so, and then we'll kick it off. 'Think folks are still trickling in here. Give it a little bit more time. 30 more seconds, and then we'll get started. All right, we'll get started. Good afternoon, everyone, and thank you for joining us today. I know a lot of school districts are out because of the weather, and so I appreciate you taking the time out of your busy day and hectic day to join us. My name is Kritesh Patel. I'm the president of HPC. And we're really excited to present today on Ohio's Medicaid school program expansion. And for those that couldn't make it today, we'll likely have a third webinar just because of the amount of people that have signed up. So, please be on the lookout for that. Before we get into the content, I wanted to set a very clear expectation for today's conversation. So everything you see in the presentation is going to be based on publicly available guidance issued by the Ohio Department of Medicaid, known as ODM. This is not an official ODM presentation. However, it is HPC's, our professional and practical interpretation of ODM materials. Ideally and essentially, we just want to provide you with the tools, resources, and guidance to roll out Medicaid expansion successfully in your specific school district. There have been significant changes over the last year with the Medicaid school program in Ohio, probably a lot more than there were for the previous 10 or 20, and Tracy might be able to speak more to that. But first and foremost, the program is now almost fully managed by the Ohio Department of Medicaid, whereas in the past, the administrative functions were administered by DEW. So, with this transition to the Department of Medicaid, there have been clear expectations from them to communicate information accurately. We as HPC work hand in hand with them to ensure this expectation is met. And so, if there's any conflicting information ever that is shared with districts by anyone, HPC will defer to the Ohio Department of Medicaid for final guidance as the governing body of the program. So I wanted to kind of talk through that before we jumped in here. Um, Today, we're going to cover a quick introduction of who we are, which a lot of you know, a quick overview of the school program, but really today's focus is going to be on Medicaid expansion, a summary of the changes in four different categories, along with some things that are upcoming and a big change within the random moment time study that Tracy will announce later into the call. We've also prepared links to the websites for plans of care and specific information that's important, along with a checklist that you can use for your district. So here's our here's our client leadership team. I'll be very quick going through. I've already talked enough. You see me on the top left. Today, Tracy Regal to the right of me, the vice president of the business, and then Cheryl on the bottom right, our senior account manager, will be doing a lot of the talking because they are smarter than me and they know this program really well. And so you will be hearing from them. Pam Katz is our VP of Business Development, Nate Williamson, our head of software engineering, and Kevin Mahaffey, our director of finance. There's our email addresses here. We will be sending this presentation out after. Please don't ever hesitate to get in touch with any one of us should you have any questions today. And then the last part that I'll talk through is this is part one of a now new monthly webinar series that we're going to host across the state of Ohio. So it's going to start with Medicaid expansion. But however, as we kind of look forward into 2026, in February, we're going to do one specific to nursing. This is feedback that we've heard from a lot of districts in Ohio. And so nursing as it relates to the school Medicaid program, as it relates to expansion, as it relates to best practices. We're partnering with a gentleman named Bob Bundy, who's known on the national scale to be a nursing expert in school Medicaid. And he's going to talk kind of through all the nursing specific things. And so I will send out a meeting invitation to everyone there. I encourage all special education, people services, student services, personnel, and if your district has nursing leaders to attend. That's always a really popular presentation. In March, we're going to do an LEA roundtable where you're going to hear from some of your colleagues. We already have a couple of SPED directors that have signed up to participate. If you would like to hop on the webinar and share your experience, please email me directly. And if we have space, we'll make sure to bring you on and we can kind of keep it an open roundtable conversation on what works well at certain districts as of the program. In April, we're going to be at OASBO presenting on Ohio School Medicaid and expansion. We're going to proudly collaborate with the Department of Medicaid and Paula Jones, the Director of People Services at Brooklyn City Schools. And so we've got state representation, we've got LEA representation, and we'll be presenting at OASBO. So we look forward, hopefully, if you're attending, to see you there. And then in May, for a lot of the CFOs and treasurers and anyone that's really focusing on the financials of the district, we're going to partner with Ray and Associates and AJ Knapp, who's a partner there, to talk about cost reporting, indirect cost reporting, MER, transportation, a few other things as it relates to maximizing reimbursement in your program. So be on the lookout for any of these links. If you're particularly interested in any one of those, again, just shoot me an email. So one more thing before we jump in, and then I'm going to turn it over to Tracy. We're going to share all these materials with you after the call. The call will also be recorded, and all this information will be sent out from my email address at some point next week. So look out for an email. Today's presentation is going to be specifically focused on Medicaid school program expansion. If you're interested in just a Medicaid school program 101, whether you're new to the program, you're looking for a refresher, please email me directly. We will just have a one-on-one with you. And if there's sufficient interest, then we will do a webinar where a lot of newer folks can get together and talk ideas with each other, and we can provide some guidance. I'm going to turn it over to Tracy, who's going to walk through the remaining part of the conversation. Please submit your questions via the chat feature that you will see on the top of your screen. There's a ribbon that runs across and it'll say chat. I will be monitoring the chat, and I will try to prioritize questions related to the actual content that Tracy is presenting, so we don't kind of jump all over the place and we throw her off. There's a high likelihood with the number of people on the call that we're going to be unable to address every question live, but I promise we will follow up with you afterward by email. And then, our emails you already have at this point, so just bug us and email us. Don't hesitate to reach out. And then the last thing is if you want to talk through how this applies for your district specifically, please email us and we'll just set up a one-on-one virtually or in person. So happy to do that. All right, Tracy, I've said enough. I'm going to turn it over to you to jump right in.
Thank you, Kurtesh. First, I'd like to thank everyone for joining us today. And hopefully when you leave this webinar, your school district will have a better understanding of how the expansion potentially can increase some of your Medicaid reimbursement. We thought it was important just to touch base on the overview of what the school Medicaid program is. And it's a program that Medicaid has approved that allows school districts to get reimbursement for Medicaid eligible services that are provided to all students in the school district. School districts do become Medicaid providers and they are the payer of record. Currently and going forward, the eligible services that school districts can get reimbursed for are occupational therapy services, physical therapy, speech, audiology, nursing, behavioral health, transportation, and medical equipment and supplies. It's important to note that the school program is a cost reimbursement model. So what that means is all school districts can obtain reimbursement from the costs that they are incurring. So the program is going to take these salary and benefits and all the costs that for the program, and they'll factor in the random moment time study percentage and your MER eligibility and other calculations. So school districts come up with an allowable cost. That is the amount the school district is entitled to get reimbursed through the program. The structure of reimbursement is through the interim payments, which is done by the documentation of the providers. And then at the end of each fiscal year, a cost report is completed, and there is either a settlement up or down either way. So as we go forward into this information, it's important to note that if your allowable cost is increasing, then that potentially will increase the amount that your school district can obtain throughout the year. So we're going to summarize four areas that are changes. The first one that I already stated is that all students receiving approved Medicaid eligible services can now potentially get reimbursed. The first category that we're going to see a change is there are new service providers being added to the program. There are 7 new providers, and if you are incurring a cost for these new providers, then you can add them to your program. The second piece is related to a new school services plan of care. ODM has created a school services plan of care for students who are non-IEP students. This will potentially increase your interim reimbursement throughout the school year. There are also new billable CPT codes. So what that means is there's additional CPT codes that are added that providers could use for interim reimbursement. And lastly, there have been significant changes to the random moment time study. Some of them you've already have felt this year. The random moment time study is now based on 4 quarters, starting in July through September. Participants who are in the random moment time study now only have 2 days to respond, opposed to the 5 days. And contracted providers are now required to be part of the random moment time study process. So depending upon how your school staffed, you may feel an impact because contracted providers in the past all went under purchase services, and the reimbursement now for those will be based on the random moment time study percentage. So that would apply and may decrease potentially what the school district did receive in the past.
Yeah. Now we're going to dive deep into each one of these categories. I'm monitoring the chat, so if you've got any questions thus far, please post them in there and we'll try to get them answered. But Tracy, you want to move forward to the service providers?
Please.
Okay.
Okay, so Department of Medicaid, this is a list of all the new providers that can participate in the program. As you will see that they're really increasing in 2 service areas, the behavioral health area and as well as nursing services. So if you are employing or contracting with any one of these types of individuals, then they can now start to participate in your program. As noted below, it also allows for interns, trainees, and students to be part of the process, but do keep in mind that if these individuals are participating, the school must be incurring the costs, be listed on the random moment time study, and encounters must be submitted by the licensed professional. Okay. Do you want to go? Okay. So to break it down, the new billable services by each service area are listed here. You can see with OT, PT, and speech, the areas that they can potentially get additional reimbursement would be for services that are based on interventions and caregiver training for activities of daily living. As we talked about before, behavioral health and nursing is really where you're going to see your impact. So for behavioral health, where you can get some potential reimbursement would be through therapeutical behavior services, screenings for screenings, interventions, referrals for alcohol and substance abuse, as well as reaching out to students with smoking and tobacco use if they need counseling to quit, behavioral health nursing services with a care plan. And also, if any of the licensed professionals are a certified CANS assessor, they can participate in CANS reimbursement. As far as nursing, there will be an screen for the test, the visual acuity test for nursing services, as well as the pressurized and non-pressurized treatments for an obstructive airway. Also, preventive care services are provided to to students. These services, though, are limited to, I believe, just the advanced nurse practitioners as well as a physician's assistant. And as well, they also can get reimbursed for the screening for alcohol, tobacco, and CANS assessors. All of these new services would be identified on the CPT codes that the Department of Medicaid approved. So HPC actually created a tracking tool that would take you down the service area that you're documenting for, and it would provide you with an idea of what CPT codes can be used in each service area, and it will identify if you need to have a referral or a care plan in place for documentation.
Hey Tracy, we have a question. If you want a copy of that tool, just send me an email directly and I'll make sure to send that tool to you. I'm not going to send it kind of out wide to everyone. I just want to send it to those folks that want to use the tool. We've got a question. I can't see the name, but in regards to the term, Tracy, interventions are reimbursable. Does this include students that are not on IEPs at this time, but may be part of an MTSS model, essentially intervention to inform overall student needs?
So yes, but what would have to happen, and we'll talk about this, is that that would require for a care plan to be in place for that. And because the Department of Medicaid has developed a care plan that would support services that are provided outside of an IEP, those services would have to be listed on the care plan.
Okay. Um, Another question, and the person that asked that question, if that doesn't answer your question, just email us directly, and we can talk more about it. The next question, nursing. Do RNs and LPNs count?
Yes, actually, RNs and LPNs are included in the nursing. So technically, we talked about the new providers, which are advanced nurse practitioners, physician assistants, and specialized nursing services. But that also includes some of the school districts who have not yet included their RNs and LPNs. They potentially can now utilize those providers based on the new services that are available to the school districts for all students in the school district.
Okay. For nursing, the second bullet point, the pressurized or non-pressurized inhalation, is it related to intermittent asthma inhaler treatments?
So that's a question that we'd have to defer to ODM and actually get back to you on clarification on the use of that specific. See, it's related to a CPT code, so we do need to get more guidance on that.
Yeah.
And
So
as
we will.
yeah,
Oh, go ahead.
go ahead. You're fine.
But yeah, we'll reach out. I'll log that question down and make sure we follow up with ODM for you and get that specific one answered. Give me one sec. Okay. Got another question. For the care plan, we would need the HPC consent form completed still, right?
Okay, so that's like, if we're talking about the parent consent is always required to be obtained for all students, whether they're special ed or not special ed. So yes, parent consent would always need to be obtained in this for the school Medicaid program.
Yeah, one time, lifetime, right, Tracy?
Mhm. Yep.
Okay, you taught me well. Okay. Any other questions on this page? The only follow-up we've got is the second item related to intermittent asthma inhaler treatments. Anything else? All right, I think it's because of snow day, Tracy. They're taking it easy on you so far. So, all right. Let's talk about the school services plan of care.
Okay, so the Ohio School Services Plan of Care is a care plan that was approved and created by the Department of Medicaid. And it is designed to allow reimbursement for services that are medically necessary to all students that do not have an IEP in place. So basically, you have to either have the IEP or this plan in order to be compliant with Medicaid's guidance. The Department of Medicaid has come up with a list of approved alternative forms or plans that can be used in addition to this specific plan. So basically, if you are using one of the alternative plans and it meets all of the guidelines, you would need to just fill out the first 3 pages of the care plan, the demographic information. You do need to obtain signatures from the parents, as well as there's a checklist. So all the 3 forms, pages do need to be completed, and then you would include one of the alternative care plans if they do meet all of the requirements that Medicaid has set forth. So there is a list on the next page of all of the plans that ODM has indicated as a approved alternative plan. Doing,
I
oh,
was
are
on
you go?
mute. Sorry. When a student is added to a therapist's, okay, well, let me start with the easier one. Jessica, where can we find these templates? It's on the Ohio Department of Medicaid website. I will actually post that link in the chat here to the actual plan itself and the guidance. Um, to bill for nursing, is it based on time? For example, a Medicaid eligible student with diabetes comes to the clinic for hypoglycemia and is with the nurse for 15 minutes. Would that time be billable?
Yes, so the reimbursement is based on either a time code or an encounter code, and depending on the CPT code that is selected, that's how you would identify if it's timed or not timed. So some are and some are not. It's all dependent on which CPT code you use.
Okay. I just put in a link to the school services plan of care. So where you can actually see the document on the website. Um, Here's another question. For students who do not have an IEP and have an Ohio School Services Plan of Care, are you required to submit a 90-day progress report note?
Well, 90-day progress report, 90-day progress is always something that does have to be compliant with any plan of care. So yes, you would still follow the same guidelines that you're providing treatment and therapy to a child, and you still will need to monitor and note progress. And that progress must be based on the medical necessity of the service that's being provided.
Okay. A
You know,
vision or
I also, oh, I'm sorry, Kritish. I wanted to also add
okay.
the, anyone who does have access to HPC's EduDoc, we did post this link in for the providers to actually download the service plan as well as the guidance so that you would have access to it that way as well.
Okay, perfect. I've got a couple more questions before we jump into the alternate plans of documentation. So a vision or hearing screening conducted by an RN LPN would be billable as an encounter.
So RNs and LPNs can actually document for the time spent doing the visual acuity. And those are not time-based, it is an encounter code. So you would get reimbursed for the time spent providing that service. I mean, it's not based on time, it's just the encounter, so.
Okay. I cut out there for a second. Was Cheryl, Pam, can you give me a thumbs up if you heard that part from Tracy? Was it Tracy that cut out or did I cut out? Okay, my internet screwed up. All right. I was told before that we were not allowed to bill for monitoring hypoglycemia as there is no hands-on care and it is mostly just monitoring. Is this still the case, or can we now bill for monitoring a low blood glucose?
In the past, it was when we were billing for treatment and therapy, it had to be a service where you were actually providing a service to the child. So monitoring, I'm not sure if that's in one of the CPT codes, but if it's based on treatment and therapy and it's prescribed by a physician, I will have to defer back on the specifics of monitoring versus actual treatment and therapy if that is reimbursable to Medicaid to make sure we're communicating it appropriately to everyone.
Okay, wrote that down as a quick follow-up. Okay, I'm going to scroll back up a couple more. When a student is added to a therapist caseload and set up to be served as non-MSP, perhaps served with an IEP but under a consultative model, will therapists have to select CPT codes?
Yeah, all documentation is required to be sent. If you're documenting, you're providing an eligible service, you will have to select a CPT code.
Okay.
And in our system, if it's not a billable service, you can still set them up as a non-billable service and not select CPT codes.
Okay.
So
do you know if, go ahead, Tracy.
I was going to say, we probably want to finish out the care plan part and talk about
Okay.
specific billable stuff at the end, so we're not getting lost in our flow.
Why don't we go to the acceptable alternate documentation here?
Okay, so the list of acceptable plans that Ohio Department of Medicaid has listed in their guidance are listed here. It's assuming that you would have this care plan already in place in your school district, and you would just only attach the new plan and complete the first 3 pages, and that would be sufficient to be reimbursed through the school Medicaid program. However, you do have to make sure that how the plans are set up and designed, that all of the requirements that are set forth by the Ohio Department of Medicaid are met.
Okay.
So that's your list.
Just I'll pause here for a second for folks to just quickly look through the plan types. And again, we'll send this information out. Okay.
So basically what the Ohio Department of Medicaid wants to make sure that if your alternative care plan does not include these components, you will need to complete the entire care plan that they're providing for you. So the required components would be that you need to make sure that it's medically necessary and based off an assessment to determine if the child needs the service. You will need the student's demographics, the signature page by parents and a school representative. It needs to be timed, so you need to have a start time and end time of when the plan would be starting and ending. You want to list the services, just like an IEP, amount, frequency, and duration, and the expected goal, what the child is to accomplish. They do expect for you to identify how you're going to monitor progress. And you do, as asked before, need to include progress notes. And you do, if you're nursing, you do have to reference inside the plan the location of where the physician's prescription will be stored for all medications. So those are the components that you must meet. So if your alternative plan does not meet all of those, you are required to fill out the full care plan, all 6 pages.
I've got a good question that you're not going to have the answer to, but don't get
Okay.
nervous. Do you know if these forms may be added to popular platforms typically utilized for IEPs and ETRs, such as Same Goal?
I'm sure, I mean, if you're asking if you're allowed to use them, I'm sure ODM would probably encourage any of the vendors or those platforms to add this form. However, I can't say, I would think that they would suggest that, but I don't know what each the individual vendor is willing to do. And I'm sure that ODM probably would not have an issue with you utilizing that form in that system,
Okay.
but I can't speak
Uh,
for them.
okay. This is the last slide on the alternate form of documentations in the school services plan of care. I think we've gotten to every question. Any more in the chat? Let's pause here as it relates to the school services plan of care, the new billable services by service line, or the eligible service providers that we talked about.
I'm just going to pipe in here with the one comment. I think ODM would prefer everybody to use that school services plan of care link. That way, if they make any updates to the form, people will have the most
Point.
recent updates. I don't think they want copies out there. I think they would prefer use of the link.
And again, we would need to get clarification on whether or not that can be used in other platforms. But Cheryl is right. The Department of Medicaid has been really good about all of their links. If you connect with them as things update, they are updating the documents and content that they have. So that is a good point, Cheryl. Thank you.
Yeah, and at the end of the presentation, we listed out that all the links here that might be useful for you as it relates to some of the documents that we talked about today. Okay. Any other questions about the new school services plan of care, new providers being added on, new billable services?
So I just kind of in summary before we move on to the next, it's really important that your program is going to grow if you're adding additional costs to the program. So if you already have your OTPT on there and there's additional services that they can now get reimbursed for, you will see that reimbursement upfront in the interim, but it's not going to ultimately increase the allowable costs. So I just want to make that very clear. That you do understand that the program and the reimbursement to the school district would increase based on the cost of the program.
Yeah. And Tracy, I'm signing you up here, but well, really our team. But happy to conduct an assessment, right? Instead of playing the guessing game of like, how does this impact us if we get on a call and talk through like, okay, maybe these are some of the new providers that we're going to be adding. How can I go communicate back to my treasurer CFO that like if we were to add these new providers, this is potentially the amount of reimbursement that we would receive? Or how do I go communicate to my CFO or treasurer that like, okay, we were not going to be adding more providers, but they'll appreciate that we're going to get more dollars sooner than have to wait on the cost report. So let's maybe just try and take a stab at, how many dollars could we potentially get sooner? We're happy to help with kind of that analysis. Okay, a lot of people are familiar, Tracy, with a lot of the RMTS changes because they've been part of it, but there's a big one.
Right.
So I'll let you kind of go through this.
Right. So as stated, contracted service providers must be included in the random moment time study. Whether they're private or through the ESC, they must be part of the random moment time study participant list that's submitted on a quarterly basis. We did discuss that the response time is cut down to 48 hours, 2 business days. And school districts do need to make sure their schools are compliant. All school districts must stay 85% compliancy. And so responses are done better if they're done right away. Also, this year we started and we added the first quarter where we actually had to submit a random moment time study participant list in July. So that is going to continue. There is going to be a new submission process that was just announced at the ODM webinar that they put out. And I don't have all the details, but ODM did announce that beginning with the first quarter of the 26-27 school year, ODM is going to be requiring school districts to be submitting the participant list directly to the RMTS vendor themselves. So it's important that we know that I don't have all the details. More details are to come from ODM, and they are hosting a webinar. And they will also be sending out this communication to all the schools with all of the expectations and shortly, but the webinar is important. So make sure if you are a manager that you do sign up and to the webinar, and the link to sign up is at the Department of Medicaid's School Medicaid Program website.
Yeah, this is a really big change. And we're going to do everything that we can to continue to support districts to take as much off of your plate as possible as it relates to this. However, we're not going to jump the gun. Like, we need to wait on guidance from the Ohio Department of Medicaid before we kind of figure out what the game plan is and what the new requirements are. And so these are kind of part of the changes, a couple of the new things that are coming on board as this program's transition. We've got a couple of questions. One, Tracy, do we know what alternative documents are preferred by auditors during the agreed upon procedures audit? I'm afraid to start billing with new providers or for new purposes, like care plans, 504s, etc., and then not have the documents requested by the auditors.
Oh, that's a good point. I will let you know that the Ohio Department of Medicaid is taking into consideration all of the new rules and guidelines, and they're working to create the agreed upon procedure engagement, which will identify what they need to review, and that would be the care plan. So until all of those details are worked out, I can assure you that as we've done in the past, the AUP, you always need to show for the 40 paid claims some sort of care plan that is signed by the appropriate people, attendance records, parent consent. All of that information will be the same, except for we now need to make sure you have parent consent for all students, and now an additional care plan. But also there are services that aren't necessarily going to required care plans to be in place at just like the visual acuity test. There is no care plan that is required. However, there does need to be documentation of the results from that testing.
Okay. For contract providers, how do we document their schedules on the participant list if they are as needed and not in the district on a regular schedule?
That is a good question, and we have been struggling with that one all year. I know Ohio Department of Medicaid does have a team now that's dedicated to address some of those questions. I would defer to them to respond. And there was different things that we were told and needed clarification on. So I will defer to the Department of Medicaid on how the response, unless Cheryl, do you have a thought on that? Because did you get anything recently?
Well, I did get an initial response. Thank you, if Hillary, if you're on the call. But I did have some follow-up questions as far as if they're not and they're considered a purchase services, can they be claimed on the cost report as purchase service? So I don't want to say anything until we have a complete response, and maybe they're working on that now. That was just this morning, so
Right. So the
waiting for
original,
more information.
right. That's correct.
Okay. And I've noted that one too, to kind of as a follow-up. But I know that we're actively trying to get clarification there. So, to do any other questions before we move on? I think this is just the detailed version of the RMTS changes in detail, Tracy.
Right. So at a high level, you can see contracted service providers, we're aware that they do need to be included. The response time, as noted, has changed. School districts do have to remain 85% compliant. So what that means is the school district has 2 moments and one is not responded to, they would potentially be at 50% compliance. So please make sure that your providers do respond to the moments quickly. The new quarter, we're aware of that. You do need to add your providers for the first quarter, which is July through September. And the moments to the providers would not start until the first day of school for each individual school district. And then the new submission process. That is just new information that we just heard from Department of Medicaid on their webinar, and details and rollout on that information is to come. And as Kritesh said, HPC and I'm sure all billing vendors are going to continue to work with school districts to see the best way that we can support you in this process.
Yeah. So I think outside of what we shared on that new submission process, that's probably the same that is what you've heard of from the announcement last week. And so hopefully we will find out more about that soon. Mac.
So MAC is it's not new, but it's a program that's always been available, but we will potentially now see school districts having the opportunity to gain reimbursement from this portion of the program. MAC it allows for school districts to receive reimbursement for non-medical administrative activities like supporting a family, potentially get Medicaid or access a Medicaid service. This information needs to be firmed up, and ODM is going to release more information going forward. This is just an example of how a MAC program works in general. However, Department of Medicaid had anticipated that it may roll out on July 1, but also I think Brittany did say July 1-ish. So we're still waiting for everything to be determined and what that reimbursement and how that will apply. What I can tell you is once these are identified as potential, I don't want to say providers, but potential administrators or individuals that can be part of this, they would be subjected to be added on a random moment time study participant list and a different cost pool. So that would be additional information that would be submitted on your random moment time study participant list.
Yeah. And we're going to be watching this one really, really closely and get prepared to try and roll it out as soon as we get the green light from the Department of Medicaid. Because this is one of those areas where it could be, an additional revenue stream for the district. And so, so excited about this one. All right, this is the resources page from the Ohio Department of Medicaid. Well, it's not from them, but these are the links here that I've hyperlinked for you to click into that takes you directly to their documents. And so this is their MSP website, their school services plan of care, their school service plan of care guidance, services, billing guidance, the administrative code for anyone who's really bored and wants to read a lot of pages on Medicaid school program. The recorded training for RMTS, the RMTS changes and implementation. This is like the new process that we just talked about. This is a link to sign up for the webinar that's coming, which I'll share. And then their support email. Obviously, you've got all these great resources from the Ohio Department of Medicaid. We aren't going anywhere. We're still here, right? So like we are also scanning all of this, working hand in hand with the Department of Medicaid as new changes go out to try to provide them to you in a digestible manner, right? And to try to pick up the pieces and support as much as we can. And so these are links to plans of cares, like the school services plan of care that you're actually going to use. And so I would highly suggest that when you look through a school services plan of care, look at the one on their website, right? Like not a hard copy that somebody else is going to send you. When you look at like guidance, look at the one on their website. We are happy to summarize the guidance. We are more than happy for you to call us. I think Tracy's read that document back and forth for like 30 times. She knows it the inside out, Cheryl and everybody. So call us and we'll walk you through it. But like, make sure that you do that as opposed to just, taking someone else's word for it. I'd say like this is the source of truth, and this is what people should be following. Um, Checklist. So Tracy, do you want to run through like this is just a standard MSP checklist for folks as we talked about a lot of detail today. Maybe this is a good step back, right? As a like a let's go through a couple of these items and how do you get
So,
paid? How do you get
right,
reimbursed?
right. So there is a lot of information, and we think that it's important that all school districts do take the time to understand and digest the information so that you're utilizing your resources in the right direction. So the first thing we would say that does the school district incur the cost for any of the new eligible service providers, whether they're contracted or employees? And that also goes for providers that you may already have that you haven't put into the program. So if you are incurring the costs, then you can add them to the program, and they must be included on the random moment time study. So make sure you include them on the random moment time study. So the services that they provide, will this provider be providing screenings, assessments, reassessments, evaluation, skilled physical or behavioral health treatment, and therapy or interventions? If yes, then it's worth looking into whether or not you should, incorporate them in the program. Also, when you go to document, if it's treatment and therapy services, or you need to make sure that it does, and they're not an IEP student, you do need to make sure that you have either the IEP or the school services care plan in place to document for that and get reimbursed. And for all students, as we discussed, you do need to make sure that parent consent is obtained. And all documents must be maintained and stored for the retention period, as we've always said with the department, with the IEP information. So all of this information, as we've discussed, could potentially be pulled on the AUP process, the state audit, or a federal audit. So it's important that as your district rolls out and implements a new process, that we are including the general population, and where are you maintaining all of these records and documents to make sure that you do have them to support an audit. So if all of that is true, that you are incurring a cost, they are on your list, they're providing any of the services and parent consent, then you can claim reimbursement for the provider or the services that are taking place at your school district.
So let's quickly talk through next steps and assistance from us. And so first and foremost, before you start with Medicaid expansion, I would just say, ensuring that all of the steps are in place at your district to ensure compliance. I mean, we've always preached compliance first. And so reach out to us if you need help. Like we would love to do a one-on-one with you in the district to determine what are my opportunities, right? Like where can I get started? What's the low-hanging fruit? What do I need more time to plan for? Some districts have more resources than other districts, right? And so like please don't hesitate to ask where HPC can lean in and really help you operationalize expansion in your school district. The RMTS changes and implementation webinar hosted by ODM. There's two different types of that webinar. The first is strictly for ESCs, and we all know that the ESCs portion of the RMTS is a lot more complicated. That's why that's a two-part series. They've got the first one on January 30th here, which is Friday, I believe, if I'm getting the days of my week correct. And then February 3rd, which I think is Tuesday. And so we've got a link, but if you go on their website, you should see a link to go sign up for that. On February 18th, I will be sending out here over the next few days a link to the webinar that we're going to host on nursing. Nursing is a big part of expansion. And I think, as you think about like the clinical part of nursing, there's the school Medicaid part of nursing, right? And there's the clinical part of nursing. And I think we're gonna come at you with both. And Bob Bundy and Tracy are going to partner together to present on that, and we are really, really excited about that. And so when I send that to you, chances are I'll reach out to Tracy to see what nursing contact information we have. but please email me directly if you have a nursing leader or someone on your team that you would like that invite to be sent to, so I make sure that they are able to attend. Do not hesitate to email me. I'll flash the screen at the end so I make sure that you're on that webinar to talk about school nursing. The um, RMTS changes and implementation hosted by ODM for districts. That's going to be on February 19th, the day after our nursing webinar. So for any school districts, please attend that training. We are going to be attending all of these as well, by the way. And so like we will make sure that if you've got any questions that weren't answered there, you can always reach out to us. And then a couple of ongoing things like arrange training with us, right? For anything. If it's the school Medicaid program or Medicaid school program, excuse me, in Ohio, if it's for expansion, if it's you need to get providers on, right? We're happy to do that. We are going to, at some point over the next few weeks, launch provider trainings and have those on an ongoing basis that's service line specific. Provider trainings for nurses, provider trainings for SLPs, for OTPTs. So be patient with us. This is all new resources that we're trying to provide to you. And so we're going to try to do that. And then look out for emails, right, on MSP updates, upcoming webinars, MAC information. We're actually bringing on to the HPC team a MAC expert, someone we've got one now, and we've got another one that we're bringing on that has done it in different states for a number of different years. And so I think that's really important. When you implement a new reimbursement program, it's important to kind of work with folks that have done it before in other states and make sure you're doing it the right way. Okay, couple of questions. On one of the earlier slides, it indicated that transportation is eligible. Can you elaborate on the transportation piece? Is this specific to special education vehicles, Tracy?
Transportation is only related to special ed. That is not expanded to all students. And for transportation, it does need to be on an adapted bus. So there are some guidelines where you do need to make sure they're in place. The student must have it listed on their IEP. It does have to be an adapted bus. And then you do need to take attendance. So yes, the attendance is taken. You can have a to school and from school, but you only get reimbursed if the student received one of the listed Medicaid eligible services that we've already discussed. So they do need to receive a nursing service or a speech service during the day for transportation for it to be reimbursed in your interim. And then of course, that does get settled up on the cost report as well.
Yep, great. Someone asked if we could post the link to the 219 webinar, which is the ODM webinar, and thank you to the attendee that's an unknown user that has posted the link to the 219 training for the Ohio Medicaid School Program. I can't vouch for the link. I don't want to click into it, and it's something that I shouldn't be looking at. So we'll let somebody do the guinea pig there.
And I will also say, if you go to, which the link is on there, the Ohio Department of Medicaid School Program website, it's right at the top. There is a link for you to register the website.
Let me pull up the MSP website because I think some folks are asking about the ESC.
I don't believe, I'm not sure if the ESC one is on the Ohio Department of Medicaid. It's not, I'm not sure if that's on there or not. That was something that was, I believe ODM had already had some meetings with the ESCs, and I'm not sure how the invite did go out.
Okay, so maybe for that one, if you want to follow up directly with Tracy, so we can quickly try to email the Ohio Department of Medicaid to see how ESC folks that weren't invited could get on there.
And that is Friday, so you do want to, we'll try. So
email you, does that make sense?
Or I think if they use the email that's shared with the Department of Medicaid,
Oh,
they
yeah.
probably could share the link quicker
Actually,
to them
yeah.
to make sure they have that.
Okay. Let me copy this here and put it in the chat. If you need a link to the ESC training, then email this email and they'll be able to provide it for you because we're not hosting that webinar. So let me, oops. Give me 1 second. Okay. So Oh, someone posted it. Hillary, thank you. This is great. Or someone did. Okay, Steve. Thanks, Steve, for posting it. So there's the registration links for all of those that came from Hillary Stoll at the school Medicaid or Ohio School Medicaid. Um, can I post the link to the 2/18/26 webinar? I can. Give me a few days, please, or early next week, and I will send out an email similar to one I sent out this time on how to register for that nursing webinar. I will invite everyone that was on this call. If there's someone specific, I've already gotten a couple of emails. So if there's someone specific you would like on that nursing webinar, please feel free to email me directly. And I will make sure that they are on there. And let me go. Whoops. Let me go to my email address, everybody's email address. There that is. So you've got that. Um, thanks, Steve, for posting the links on the webinar. So I think that's covered all of the questions so far. Um, we've got 5 minutes or so left. So we'll stay on for anyone that's got any additional questions. I'll keep this slide up and write my email address down, and I'll make sure to send these materials to you early next week at the latest, so we get everything out. The ESC links require Edge. Very strange. Interesting. Well, you know what I'm going to do is I'm going to give you the email address for ODM, and you can maybe send them that feedback. And so maybe they'll be able to open it up to Chrome. I mean, we'll let I can do that too. Yeah, I can we can see if they can accommodate for different browsers like Google Chrome or something like that. But okay.
I do want to say too, Department of Medicaid has been sending out frequent communications to all of the school districts involved of all the updates and changes. And if your school district is not getting that information, you may want to email Department of Medicaid and
I just put the email in the chat too.
right.
Like
And I was going to
that's
say,
it.
ask them who the contact person is. The information that was shared with them, as Brittany had said, we gave them information, but things do change throughout the year. So you want to make sure that your school district is getting the correspondence that's from Ohio Department of Medicaid.
Yep. On that note, as they send out correspondences on rule changes, on anything new to the program, like rest assured that we are on top of it and we'll get with you as soon as we feel very comfortable with their guidance on summarizing everything that we can. And so I think at this point, with all the changes coming down, we like, for the most part, to just wait and see what they're going to release without playing a guessing game, so that we're not going to give you information that's not true. So we will be sure to update you on things in a timely manner. 3 more minutes. I think we can stick around for any other questions that come through. But that's it for content. I really appreciate everyone jumping on. I mean, it was a snow day, and I think we had 140 plus people on a snow day on schools are out. So I think that's pretty awesome, and then really appreciate everyone's participation. And we're going to do it again tomorrow at 9 a.m. So if you want to join that one, you can hear the same thing tomorrow.
And as Kritesh said, he will be sending out the presentation
Yeah.
and follow-up questions that we need to address and get back to you. So everybody will have that information.
Yeah.
And thank you very much for your time. As Kritesh
Yeah.
said, we do appreciate it.
Yeah. If you have any feedback, anything that you want to see webinar wise, anything you want to talk to us about, just email us. We will try our best to incorporate that, but we love feedback. Here's a question. If related service providers are contracted on a daily rate and not per student or hours, what is the cost benefit of billing for non-IEP services?
I think that's specific to each individual district, depending on what the program looks at this time. As Kritesh said, you could reach out to him directly and we can assess that. It's important that the random moment time study participants has the contracted because they have to determine what percentage of time, just like everybody else, is spent on Medicaid eligible services. And responding to your question, I think that's an individual response based on your school district.
Yep. So if you want to talk specifics, just email us and happy to do that cost benefit. Okay. Last
Thank
minute, anything else? Thank you, Tracy. A lot of folks have said thanks, and this was very helpful. I'm assuming that's directed at you and not me. So, okay. All righty. I hope everyone stays safe during this really cold and snowy weather. And thanks again for joining. And I'm going to leave this screen up here for just a little bit if you want to copy our emails down and send something our way. Have a
Thank
great
you.
day. Thanks. I don't think we've got any more questions. I think I'm just gonna end the event. Right.